Hello, everyone, and good afternoon once again. Dr. J here at Ask the Gynecologist. And tonight, this afternoon, I'll be talking about a special topic or list of topics I posted on the Facebook page over the week. And I made mention of Hsg, Hysteroscopy, and Esterosanogram. And people thought these things meant the same thing. Some people were confused. Some people thought they had hysteroscopy, whereas actually they had Hsg. Some thought they had Hsg, actually they had hysteroscopy. So many people were confused about these similar names and similar sounding investigations, and people were confused. So we are simultaneously broadcasting on Instagram. We are also talking on Facebook Live, and we are also recording as well for YouTube publication. I'm trying to adjust my cameras on Facebook here so that people can see my whiteboard in my office here. So thank you for everyone. So people can see my whiteboard here on Facebook, and I think the whiteboard is also showing properly on the YouTube page, and on Instagram people can see me clearly as well. Once again, my name is Dr. Alalade Babajide at AsktheGynaecologist, and I'm so happy to be here this Sunday. It's a blessing, it's grace to be live and to be alive as well. So thank you guys for being patient with me, for me to recover from the normal on-call work at the hospital, because sometimes I'm always on call. I have to go to my clinical job as well, and then in my spare time at home, I come here live to discuss with everyone. I would love to be talking every day live, but it's not entirely really feasible. So I have to take time off as much as possible to ensure that I spend time with you. Most importantly, people I love on internet, and to expound and to get you information so you know more about your body, how your body functions, and the things you need to do. So tonight, this afternoon, I'll be talking about hysteroscopy, Hysterosonogram, and Hsg. So get set as we talk this afternoon. We have about 17 people viewing now. I'll wait for people to join a bit, then I'll start as soon as possible. Thank you so much. Marianne Joseph, if you subscribe, Marianne Joseph, I can see your message here, okay? If you subscribe to the Diamond service, and it's not only for you, anybody that subscribes to a Diamond service, okay? We have protocols, okay? And the protocol is for you to send your proof of payment to the ATG services email. And once you send your payment evidence to the email, we will give you my WhatsApp number, and I consult with you on my WhatsApp number. I think you've been calling me yesterday while I was at work on my messenger phone, and I cannot answer your call while I'm in theater. It's not possible. I cannot be operating on a patient and I'll be answering you while I'm in theater. When I get home, I'm usually exhausted, I want to sleep. Then I'm back again. So if you've been on the Diamond service, please, me and Joseph, follow protocol. That is why when people don't follow protocol, they get answers that they didn't supposed to get. So send your payment evidence to the ATG service 2018 email. Christina will give you the email. Follow the instructions, and I'll give you my personal WhatsApp number, and you can contact me easily. Okay? ATG has been here for 7 years, okay? And I've been a doctor for almost 21 years, okay? I'm not a person that want away with your money, okay? You pay 20,000 naira for Diamond service. My job is to give you the best service, but you have to follow the instruction. A lot of people in Nigeria, I must say, totally regrettably, and with all due apologies, that we Nigerians don't like following instructions. It's our nature. I'm sorry to say that, but it's just the truth. If we follow instructions, Nigeria will not be in the state we are today. That's the honest truth. We don't like following protocol. Do this to get this, okay? There are standard laws in this world. If you throw a ball up, it will always fall down because there's a law of gravity. We've put in rules in place. If you pay for Diamond service or any services, just send an email. If you pay for a seminar, send an email with the payment evidence, and it's our job to reply you. If we don't reply you, contact any of our moderators here and they will guide you. But you coming up here and start giving people bad vibes is no use. I'm not a 419, and I can never be, because my name is a proper name. I'm Babajide Alalade, and my name is everywhere in the world. I cannot run away with 20,000 naira. I'm better than that. People, they've run away with more money from me than that, and I'm still standing by God's grace. So your 20,000 naira is even less than the service I'm going to give to you. So my job is to give you a service. I cannot collect money from you and run away from you. No. I'm a man, I'm a human being, I'm a family man, and I feel for you. You trying to get pregnant, it would be the worst thing for me to do to run away with your money. No. So if you've joined, you've paid, just simply follow instruction. And it's not only for you, it's for every other person too that has paid for any of our services, whether gold, diamond, premium services, diamond and platinum, GTC, ANC, or seminar. Just send your payment evidence to the email, and that is all. Easy. But people will not do that. Just because you are a friend of mine on Messenger, you think you can bypass protocol and start bombarding messages on Messenger. You call me at all times. Sometimes I can answer, sometimes I can't answer. I can never be doing a C-section and I'm picking up a phone call from you. It's not possible. I can't do that to you. I cannot be operating on you and I'm picking a phone call from another person. No. I have to put my attention at work. I'm a doctor attending to cases on the wall, on the floor. Okay, I get home, I'm online like this. I just came from home, I'm online. So there's no way. Please try to understand. I'm a human being like you, and I have feelings for you too. I know you've worked hard from these mornings, therefore you've parted away from them to give it to me, to give you a service. And my job is to give you that service, but you have to know how to follow the protocol. The protocol is simple. Okay, just follow it. Okay, today back again, we're talking about Hsg, Hysteroscopy, and Hysterosonogram. Okay, Hysterosonogram. A lot of people, because all these names sound similar, people get confused and they think they are all the same. They think these procedures address the same issue. It's true. Whenever you hear these names, hysteroscopy, let's write it on the board here. Let's see. People can see on Instagram anyway. So we have hysteroscopy. Let me put it in capital case, okay? So that is hysteroscopy. Okay, and then we have Hsg, Hysterosalpingogram. Okay, and then we have Hysterosonogram. Thank you, Christina Ladumoye, for giving Mary and Joseph the right email to contact. So we have these three things here that are very, very confusing. The hysteroscopy, hysterosalpingogram, and hysterosonogram. Okay, they all sound the same because they have a common denominator. Hystero, 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 hystero. Okay, so it sounds same, confusing. They are similar. They do very similar things, but they are entirely different. So today, my job is to explain these things to you. And you see the common things and the common denomination amongst all these tests and what we use them for. I will not, I have many viewers watching me. Some are doctors, some are just, patients. They don't know much about medical terminology. And some people, they know a lot about medical terminology. So if you're a doctor, I'm not going through the full medical intake in details. I'm only trying to summarize this thing. So if I don't touch the details, don't think I don't know what I'm saying. I'm just trying to be brief for the case of explaining to our people watching me all over the world and that might watch me in future to learn about these things. You can Google your phone to know about what all these procedures mean, right? But some of the terms you're going to read on the internet, you might not understand them entirely, but my job is to expatiate and to differentiate them for you. So then let us continue. So basically, the first one is hysteroscopy. Scope means to look. Whenever you hear scope, telescope, kaleidoscope, scope means to look. Microscope, to look. Micro, to look at small things. Microscope. Hysteroscope. Hystero means womb in Latin. So that means that hysteroscopy is essentially to look into the womb cavity with a camera. So when you hear hysteroscopy, it's not ultrasound scan. It's to put a tiny camera, it's usually very small like this, through your cervix into your womb to look into your womb cavity. It can be done while you're awake, while you're asleep. At the ATG IVF Center, we do hysteroscopy while you're awake. Basically, office-based hysteroscopy. We do it with saline while you're awake. That is hysteroscopy. For hysteroscopy, we have to use something to, because your womb cavity is always close to, you see, this your womb cavity is not open like this on a normal day. Everything is close together. Okay, so we have to first of all distend the cavity, okay, with some fluid. So we put in usually normal saline through that hysteroscopy camera. That camera has about 3 channels. A channel to view, which is the camera port. Another channel at the tip to pass fluid to distend the cavity, usually normal saline. And another channel there to pass in maybe a tiny instrument to remove anything we see in the womb cavity. Maybe like scar tissue, fibroids in the womb cavity. We call it submucous fibroids, polyps, lost copper contraception device in your womb cavity. So hysteroscopy is basically to look into the womb cavity. Basically it's called diagnostic hysteroscopy. Or we can also do what we call operative hysteroscopy to treat and take out any scar tissue in your womb. For my viewers coming online, I want to say good afternoon to you all. I can see you. My name is Dr. Alalade, I'm the AsktheGynaecologist, and I can see you so much. I want to welcome Aloha, Nkechi, Sylvia Nokwa, Miriam Joseph. Thank you for joining. Vivian Dico Briggs, I can see you all. Thank you all you guys for joining tonight, okay, and for joining this afternoon. Miriam Joseph, you've been taken care of by Christina Ladumoye, okay? You should have done this better, okay? But thank you, Christina, for sorting out Miriam Joseph. So that is hysteroscopy, basically to look into the wall of the womb, to look into the cavity of the womb. Hysteroscopy. Hysteroscopy can be done just to see the womb cavity. It can also be done to treat any issues in the womb cavity, to take out fibroid, polyps, remove lost intrauterine device, so on and so forth. It can also be used to check the tubes, the opening of the tubes, okay? And also can be used to know if a woman has an abnormal womb. Sometimes some people, instead of having a normal womb like this, they have only half of the womb, okay? Hysteroscopy can help you to really get into details, okay? So, more than ultrasound scan would do for you. Now, but hysteroscopy is not to open your tubes. If you have blocked tubes, okay, hysteroscopy is not designed to do that. Now, the next one I'm going to talk about is the Esterosapingogram. I'll go over all of them again, so pay attention. The Esterosapingogram, okay, look at it again. It says Estero, that is womb. Salpingo or salpinges in Latin is tubes. And gram means to study something, to weigh something, to study something. So we are studying the tubes and the womb cavity. That is this hysterosapingogram, the popular Hsg, which people say is always painful, always uncomfortable, okay? That is Hsg. Hsg is a fertility test, okay, to check if the tubes are open or closed. Is one of the ways to check if the tubes are open or closed. The other ways we can do to check if tubes are open or closed is by doing laparoscopy and dye test, which is an operation. We put you to sleep, put a camera through your belly button to look into your tummy, okay? That is laparoscopy. And another test to do to check if the tubes are open or closed is sometimes we can use what we call Esterosanogram, but it's not really for that. To check if the tubes are open or closed, 2 main tests, okay, is the Hsg, which people say is painful, and the laparoscopy and dye test. Laparoscopy and dye test. Okay, now, what is Hsg? Remember I said Hsg contains 2 things. Estero, womb. Salpingo, tubes. Gram, study. So basically, we are studying the tubes and the womb. So what we do in Hsg is simple. Assuming this is your womb cavity. So this is your womb cavity like this, okay? Okay? This is your tubes. This is your tubes here. I mean, those are your tubes there, okay? So the womb cavity is like that, okay? And the womb cavity is like that, okay? That's the wall of your womb, okay? So that is your womb cavity, okay? That's your cervix that opens. That's your tube here, your tube here, and here, and here. Okay? Now, what we do in Hsg is that we pass a tiny cannula, a plastic, into your tube, into your womb, through your cervix, okay? Or we can even use, there are 2 cannula we can use. We have the Leach-Wilkinson cannula, that's not your business, don't worry about that. And we also have a plastic cannula, okay? Like a rubber. basically goes through your cervical os. The cervical os is a pinpoint opening on your cervix that opens your womb cavity to the exterior. It's usually closed. Okay, if we do your Hsg a day or two after your period ends, it's easier to navigate into your womb cavity through your cervix from the os. The os of the cervix is the opening of your womb cavity into your vagina, into outside. Some people, they've never had children before. Some people, they've had operation like LETS procedure on the cervix before, and their cervix can be stenosed. Stenosed means tightly closed. In such a case, it's not easy for us to navigate the cervix, and that is what makes Hsg very uncomfortable. So what is Hsg? Hsg is an X-ray test. Hsg is an X-ray test, okay? So Hsg is what? Essentially an X-ray test. What do we do during Hsg? Okay, we flush in a dye. That dye looks like water, it's not water. We flush in that dye through your womb cavity, and the dye goes into your womb cavity and flushes into your tubes on both sides, left and right. And if your tubes are not blocked, it spills into your tummy, left and right on both sides. And after a while, your body will reabsorb the dye. Okay, but as soon as the dye goes through your tubes and spills out into your tube like that, we take an X-ray, what we call a fluoroscopy technique. We take an X-ray and we can see the dye flowing through your tubes, and that gives us an impression that the tubes are not blocked. Okay, if we cannot flush in the dye, or maybe the dye gets stuck somewhere here and forms a big ball there, what we call loculation, or like that, it means that that tube on that side, on both sides, if it happens on both sides, that means that that tube is blocked there. We see that collection on X-ray. Sometimes I've seen a lot of people, their tubes are not blocked, but there's what we call tiny debris or collection that is causing obstruction in the tube. And in most cases, during Hsg, those tiny obstructions get dislodged. And people that do Hsg, suddenly their next cycle, they do sex and they get pregnant, and they think that, oh, they got pregnant because of Hsg, and they tell their friends, and their friends assume that they too should go and do Hsg because Hsg won't block their tubes. It's a wrong notion. Hsg is not designed to unblock tubes. If your tubes are blocked from a previous infection, because the number one reason why tubes are blocked is because of a previous infection in the past. If you had a previous infection in the past, infections like chlamydia, infections like gonorrhea, infections like E. coli that are repeatedly happening over and over again and that are not treated appropriately, they cause cumulative damage to your tubes. You have infection 1, infection 2, infection 3, maybe treated or not, they cause cumulative additive damage and they block your tubes eventually at some point. So therefore, if we do Hsg and the dye is collected in your tubes like that, it means that the tubes are blocked. And if your tubes are blocked, sometimes it's a tiny blockage and we are able to unblock them during Hsg, fine. If we can't unblock them, in such a case, we usually advise to go for IVF. Another reason why you could have blocked tubes is not only infection, also what we call severe endometriosis. If you have a severe endometriosis that has caused scar tissue around your tube opening on both sides, they block the tubes and the tubes are not able to move and capture eggs being released, and then it causes blocked tubes. You can have severe endometriosis that can cause permanent blockage that are not reversible. It is true. Some people also do have what we call endometrioma on the ovaries, left or right, that can cause permanent damage to the tubes as well. So basically, Hsg is a study to check if there's blockage in your tubes or not. In some cases, rarely speaking, they can help to unblock tiny blockages in the tube, but Hsg is not designed primarily for that. People in Nigeria, I know, I'm a Nigerian, I know this, I'm telling you the truth. Sometimes we take things for granted. Because your friend did Hsg, she's trying to get pregnant 7 years ago, she did Hsg last month, she did sex last month again, and she got pregnant. You want to jump into Hsg because you think that your tubes are blocked. If you do Hsg, it will be unblocked. Hsg does not unblock tubes, so that is the honest truth. That's number 2. Number 3, the last one, Hysterosonogram. Now, listen to the name. The name is hystero. That is to say, womb. Hystero, womb. Sono means sound. Sound. What is sound? Usually ultrasound scan. Okay, they can't put the full name. Hysterosono is too long now. It's tongue twisting. People like me that stammer sometimes. I can't pronounce Hysterosonogram, whatever. It's too long. So we make it short. Hysterosonogram. Basically, what it means is that we are trying to study the womb cavity through ultrasonic techniques, and it's a study. That's all. And what do we do? How do we do hysterosonogram? Now listen, it's very straightforward. Now I'm trying to clean up all this my arrows so I can use it to explain better. So listen to me attentively as I explain how we do hysterosonogram. So let me quickly get back all these my diagrams to get all this out. So once again, these are the tubes on both sides, left and right. What we do for hysterosonogram is that you go to the doctor, you lie down on the couch, open your legs as usual, we put in a speculum so that we can see the vagina. See, normally when you lie down, when you slide down, your vagina is closed. We can't see anything. It's a dark tunnel. We got to see. So what we do is we pass in the speculum into your vagina, open your vagina up so we can see the dark tunnel. We can get some light in there and we can say, let there be light, and let God start his work. So basically, we put a speculum, we can see what we need to see. We put in a catheter, okay, there, into your womb through your cervical horse. So that's the catheter there in your womb cavity. Once we do that, the catheter comes out and we plug it into a saline tube. Saline tube is a syringe that contains saline, or that contains like salt water we use. We call it salt. It's normal saline, but something like salt water, okay? So that is connected to that at the end, outside. We remove the speculum so you're more comfortable, you're more relaxed. At the same time, we put a scan on your tummy. So that's why people that are a bit on the big side, hysterosonogram is difficult to do for them. But if you're on the thin side or normal BMI, not too big, not too robusty, we are able to put the scan probe on your tummy while we leave the catheter there. So we're now flushing fluid from the catheter and it goes into your womb. Okay, so the fluid goes into your womb everywhere in your womb cavity. Okay, easy. Okay. So once the fluid is in your womb cavity, okay, we put the scan probe on your tummy and we are able to see your womb cavity clearly, because once there's fluid in your womb cavity, anything that is there, maybe scar tissue, maybe fibroid, maybe polyps, we're able to see them floating clearly, okay, and we can see things much better. And in some cases, if that person has good ultrasonography skills, if that person has good skills to do or perform ultrasound scan, they can easily as well see the normal saline fluid moving through your tubes and trickling down outside your tubes on both sides, left and right. And that could be sufficient enough to take care of checking if your tubes are open or closed by doing HSG. So hysterosonogram, in some cases, with appropriate technique, with a good machine, can be sufficient enough, and it can be enough to check if your tubes are open or if your tubes are closed, what we usually do for HSG. Not all centers have good scans. Not all centers have the power to do hysterosonogram. Okay? So, now, this is making sense. This is making what? Sense to most people. People are also watching us on Instagram. For people watching us on Instagram, I'm so sorry if I've not paid attention. I've paid attention to you as I'm talking, because I actually forgot behind me. So if you're watching me on Instagram, I want to say good afternoon to you. I want to say thank you for joining us this afternoon to listen to the things we're going to say and things we're saying. So I'm still back with you on Facebook. So if you're just joining us, I want to say my name is Dr. Alalade Babajide on Ask the Gynaecologist, and today we're talking about hysteroscopy, Hysterosalpingogram, and Hysterosonogram. So if you have any questions now on the screen, on the page, please pass your question across to me and let me answer your question. Thank you, everyone. So if you have any question, please come up with your questions. Let's pick them and let us see how we can expatiate on them. Now, if you subscribe to the ATG premium services, whether it's gold, whether it's diamond, whether it's platinum, whether it's a consult service for 1 month or consult for a week, or you're joining the Telegram for antenatal, Telegram for GTC, once you've paid, do two things for me. Number one, send your payment evidence to our email. Our email has not changed for the last 3 years. It's atgservices2018@gmail.com. That's number one. Number two, once we get the email, give us about 1 hour. We'll reply you. Sometimes I could be at work, I could be sleeping, or my secretary could be busy in the laboratory. Once we get your email, we'll reply you with the link and instructions to follow to activate your subscription. So once you get the reply back, follow the reply, the instructions in detail, okay? And we start consulting with you from there. In most cases, if you subscribe to the premium services, Gold, Consult, Platinum, whatever, you'll get my WhatsApp number and I can start conversing with you, going through your results. Number one. Number two, if you've joined the antenatal or the GTC, we'll send you the link to join the GTC or antenatal group on Telegram, and you follow the instructions and you carry on along. There's a question here by Chidi Eberia on Instagram. She's saying that doctor told my husband that if he ejaculates, the sperm do divert. What does it mean? I don't know what it means by divert. I think you probably got the name wrong. I don't know what you mean by divert. So probably see your doctor again and he or she sit them down, or you sit down with them and exactly get, if possible, write it down in front of them to know exactly what word they use, because I don't know what you mean by the sperm do divert. There's nothing called sperm diversion in medical science, in Gynae, and I've been doing Gynae for almost 18 years. To God be the glory. I don't know what you mean by sperm divert, okay? So please help me with that, and we'll take it from there. Good evening, Doctor Amupa. Thank you. Good evening. Igwe Boise, Ngozi, Anastasia. Good evening to you too, and happy Sunday. Thank you so much, guys. I'm really having fun today. So there's a question here on Instagram that is Bolanle. She's saying that, is IVF the only solution for blocked tubes? First of all, one of the solutions for blocked tubes is, first of all, one, to do what we call hydrotubation. Hydrotubation. Hydrotubation, okay? Hydrotubation is a technique where we use fluid under pressure to force the tubes that are blocked open, but it only has a 25% success rate. 25% success rate. 1 in 4 patients. Only 1 person gets success out of every 4. Depending on the skill, depending on how long the tubes have been damaged for, it can be successful or not. So we can do hydrotubation. But if hydrotubation fails, then the next step is to consider IVF, okay? In fact, most doctors will say, once the tubes are blocked, go for IVF. It is true, okay? Back on ATG Facebook, we got a question here. Son is saying that, is it possible for a woman not to be seen at ovulation after months of miscarriage? It's possible, but very unlikely. If a woman had a miscarriage, it's not to say that she's not ovulating. She had a miscarriage, fine, sad. But usually within 6 to 8 weeks, the periods are back again. And in most cases, if a woman is having a regular period, they are likely to be ovulating almost 80% of the time. Thank you so much, Sonny Alabi, for your question. Abiola Ajaguna is asking a question. Can someone do Hsg, you mean? If a period that's supposed to flow for 3 days, for 2 days, yeah, you can. Yeah, Abiola Jagona, you can. Thank you so much. The question here on Facebook. Thank you, guys. Okay, I'm just scrolling through questions here. Another question here on Instagram says, "Good afternoon, doctor," from Yusuf Amina. Is there a treatment for endometriosis? Yes. If you have endometriosis, the treatments are to use painkillers, first of all. Option 2 will be to consider using contraception, which are hormonal. But those contraception like progesterone, Mirena coil, okay, or contraceptives, estrogen-based contraception, they will make you not to get pregnant while you're taking those medication. Another option is to consider surgery, where we put you to sleep, put a camera through your belly button with a small tiny laser to go and burn off the endometriosis wherever they might be, at the back of your womb, close to your womb, or anywhere we can see that is safe. We destroy the endometriosis. So that one will make you escape having to use medications, okay? The ATG IVF Center is open now, and we are already taking the batch for the August IVF, okay? If you want IVF, you want to partake in this promo. Last week we did a promo and we charged people 1 million for IVF, excluding drugs. If you want to partake in the promotion, last week is gone. This new week is back to the usual price, 1.1. Costs are going up in Nigeria. If you want to do IVF, what I will explain to you and I will admonish you to do is that try and do one thing. Just call the lab tomorrow morning, 9 a.m. and put a deposit down to secure your price of 1.1 million standard. So that whenever you're ready, you balance it up and you're okay to go and you fix the price. But if you don't put a balance down, whenever you come maybe a month or 2 months time and you want to do IVF, the price will have changed because we have no power to fix price because Naira is depreciating. It affects the cost of everything we use in Nigeria, including our IVF unit, everything that is brought in from abroad, the medications, everything. So what we do at the ATG IVF Center is to separate the cost of drugs from the cost of the IVF itself. So for the IVF itself, it's 1.1 million from today onwards. And the drugs usually about 350 to 450 usually. So the drugs you can get on your own. We give you what to buy, or we can get the pharmacy, our supplier, who supplies to us at wholesale, to bring the medication into our center, and you pay to them directly, not giving us your money. Just pay to the drugs people, and they give you the medications, and we tell you how to use them. But the IVF without the drugs is 1.1 million. You need the drugs anyway. So instead of you going to buy the drugs in Endometriosis or Agege and getting some fake things, we bring in the suppliers that we trust. 2 of them, you can compare prices. Or you can even take their quotation and go to the market, okay, anywhere you want to go, to compare their prices with the market, and you choose with anyone that suits you. You buy your drugs. That's fine. We saw that the IVF, 1.1 million. Prices are going up. They are changing. If you want to take advantage, today is the day. Call the lab tomorrow. Okay, now let's go back to the question time on Facebook. So the ATG IVF Center is sponsored by the ATG Women's Health Foundation, and they are trying to ensure that IVF is subsidized. If anybody is offering you IVF without drugs for less than 1.1 or 1 million in Nigeria, they're just wasting your money. Okay, I can say that with at least 80% confidence, or even 90% confidence, that if anybody is giving IVF without drugs in Nigeria for less than 1.1, less than 1 million naira, they're trying to skim you of your money. And when the IVF does not go well, they tell you, oh, sorry, it didn't work out, that's all, your money's gone, smoke. But at ATG IVF Center, we stand behind the brand, we stand behind the name, and by the grace of God, God no go shame us. By the grace of God, God no go shame you, and success will be yours. People that had their transfer 2 weeks ago, they're already pregnant now, and they started their journey to pregnancy. Why don't you take this step today and be amongst them? Question here from Nahoma Vivian. She's saying that, good afternoon, doctor. I gave birth 10 months ago. I saw my first period after 7 months, April, June. Started again. Now you're seeing blood. It's not much. Something like that. What could be the cause? Usually hormonal imbalance, usually fibroids or polyps. What you need to do your hormonal test, do your ultrasound scan to check, and if possible if ultrasound scan does not show anything, you can even do hysteroscopy to look into your womb cavity and to treat any mass or any issue that we see in your womb. For people outside Lagos, what can they get? How do you advise them? So somebody's saying that if you're outside Lagos, you can travel to Lagos. People are traveling from America, from Italy, from London to do IVF at Agege Center. If you're in Nigeria, coming to Lagos is not a big deal. You can travel to Lagos, get an hotel. What you can even do is that you can come, get your treatment, go back to your base. You don't have to stay in Lagos. Just come for your scan, your treatment, get it done, go back to your base, rest. When it's time for the transfer, come to Lagos a day or two, get your transfer done, and go back to your base. You don't have to stay in Lagos. Okay, so distance is not the reason not to get what you want. Distance should not deny you from your birthright. Distance should not be a bar. Distance should not be a toll gate to your blessing. Good afternoon, doctor. Selective IVF, how much got to genotype? So for you mean that you want to do IVF and you want to ensure that your baby doesn't have a bad, an unusual genotype? It's very straightforward. It can be done at IVF. We can do that for you, and we do the analysis. And the full price, I don't have it in my head because I can't put everything in my head. But call my secretary tomorrow morning, 9 a.m., and they'll give you the price for this IVF you're talking about and to do genotype screening before the eggs is being transferred back into you. Okay, Okay, let's see some questions here on Instagram. So on Instagram, there's a question here by Ladi Empire. I was told discharge mixed with mucus is sign of estrogen. What can I do because discharges are being a lot? You've done tests, yeast infection has been found. It comes every day. So if you have yeast infection, so basically you've done your vaginal swab and everything is normal. The only thing they say is that you got yeast infection. So what you need to do is to treat yeast infection, I'll say every week. As far as there's no other issue in your vagina, there's nothing wrong in having discharge. I tell people all the time, every vagina has a discharge. Some is more than the other. Like some people sweat more than other people, okay? As far as there's no offensive discharge, there's no itching. We've done your vaginal swabs and there's no organism. If it's just yeast infection, we treat it. Don't panic. Some people, they'll just want the vagina to be dry. Okay, now if it's dry now, you now come again, my vagina is not dry, what should I do? Why don't you let the vagina be? As far as there's no infection being found in your culture, there's no offensive discharge, it does not itch, your discharge is not blood stained, leave the vagina alone. It's self-cleansing. Okay? Doctor, if for twins, same price? Yes. If at ATG Center, if you produce enough eggs and we can see 2 quality eggs, we'll give you back the 2. We don't keep it. We don't need it for anything. So the price for IVF twins is the same price for IVF 1 baby. As far as you have, but in most cases, we try and transfer 1. But if you have 2 good quality eggs and your health is okay, there's no issue with your kidney function, there's no issue with your liver function, we'll transfer the 2 eggs back to you. We don't need it for anything. Because if we don't give it back to you, it's a waste. Okay? So we give you back your 2 eggs. We don't keep it for anything. So the lab phone number, I did tell you I Alalade Somi, I did been pay. The lab phone number has already been placed by your comment by Vivian. Call the laboratory tomorrow morning, 9 o'clock, and ask to speak with Nike, my secretary, or Yemi, the nurse in charge. And she'll give you the price breakdown and all the details. And you can also walk into the ATG IVF office, okay, and speak to Dr. Chioma. She'll go through your results and then she'll tell you what to do. And she can even advise you better, at least to give you confidence that we are not just people on Facebook, we are people on ground. We are people live. Ekene Charles is asking for phone number. Please help me give Ekene Charles our phone number. Help me give Ekene Charles our phone number. Someone is saying a question. Can a pregnant woman take COVID vaccine? It's been proven to us now that COVID vaccine is safe in pregnancy. You can take your COVID vaccine in pregnancy. But if you're not sure, if you're not convinced, then leave it alone and take appropriate precaution. Dr. J, what are the tests one need to do when trying to get pregnant? What are the tests you should do trying to get pregnant? Okay, so you're trying to get pregnant, it's not happening to you, you want to know what tests to do. Listen, we'll talk about them. If you're trying to get pregnant, okay, and you've been trying for at least 12 months, okay, and you are both 35, 12 months, you're both 35, you should be doing your FSH. You should be doing your LH hormone test. You should be doing prolactin. Thank you, my sister Cecil James. My sister Cecil James is online. She's here with us and she's ATGN for life. Thank you for that, my sister. God bless you. So we do your prolactin. Okay, we do your Hsg. We do your AMH hormone. We do your day 21 progesterone. Okay, and so on and so forth. And also we do your husband semen analysis. Okay? Why are we doing all this tests? Why are we doing all this tests? I mean, now, hold on Instagram. I'm going to answer your question shortly, okay? And there's a question as well saying that, would you recommend IVF or IUI for infertility? Hold on. That is from Spirals Hair on Instagram. The semen analysis is important to check if your husband's sperm is okay. Your FSH, LH hormone to know whether you're ovulating. And as well your D21 progesterone. Your AMH to check your egg reserve. Your prolactin level to check to see if your prolactin is too high. And also we need to do your thyroid function test to check your thyroid hormone. and your Hsg to see if there's any blockage in your tubes, okay? For IVF, Vera Jerome, hold on. Somebody will give you the link and the phone numbers, okay? So hold on. Vera Jerome, you get a link to call the phone number tomorrow morning. So first of all, there's a question here on Instagram. Spiral is asking that for someone that has unexplained infertility, is it better to do IUI or IVF? If you have, I always tell people all the time, in most cases, almost 90% of cases, whenever a couple is doing IUI, the idea is that the man has the problem. Maybe the sperm count is low, oligospermia, or it's difficult to retrieve the sperm. We go do surgical sperm collection, and then we transfer the sperm back into the woman through direct insemination, IUI. Whenever we're thinking of IUI, it's usually the man has a problem. Whenever we're thinking of IVF, okay, IVF is it's usually a woman, the woman has a problem as well. So when you see IVF, it's either the man and the woman has a problem or only the woman has a problem. This is just a general blanket advice. Therefore, if you have unexplained infertility, there's a high chance that the woman has a problem too, or it could be the man only. Or it could, so because of that blanket thing, that is unexplained infertility, what I would advise is IVF, because it's unexplained. IVF, I don't know. So now the next question is that from Amina is saying that what is the best treatment for endometriosis for someone trying to conceive? If you're trying to conceive, you have endometriosis, then in that case, you might want to avoid using hormonal medications like myelina coil contraception and all that. You might want to consider doing surgical treatment to deal with the endometriosis once and for all. Now, back to Facebook. Dr. J, can a low-lying placenta be corrected at 37-week scan? It can, but we don't do anything. If you've done a scan at 20 weeks or 18 weeks or 28 weeks, and you're told that your placenta is low in the sense that it's very close to the entrance here of the cervix. So your placenta is here, is low. It can be here, is high. It can be here, is not low. But if it's here, close to the cervix, is low. Okay? But in most cases, as the womb gets bigger, the womb will pull the placenta away. Usually, if after 34 weeks, placenta is still low, it's probably going to remain low. Okay? But before 34 weeks, okay, placenta can move away. But we don't move it. It moves on its own if it's going to move. If it's not going to move, it will move. Doctor, is it true someone can see their period and not ovulate? It is true. Joy Onalo. Dr. J, good afternoon. What about if you are not 35 years old and you've been trying, what I tell you to do? If you're not up to 35, okay? If you're younger than 35, you don't need any test for infertility except you've been trying for more than 2 years. Because if you've been trying for more than 2 years, most people will get pregnant at the end of the second year, almost 95%. If after 2 years you're not able to get pregnant, you fall into the bracket of the 2 to 3% or 5% of people that cannot get pregnant on their own. If after 2 years of trying means you're having regular sex 2 to 3 times a week, okay? Whether you're ovulating or not. The only time you're free from sex, I say all the time, is during your period. The only time you're free from sex is during your period for the purpose of getting pregnant though. If you've been trying and doing that regular sex for more than 2 years, you're young, less than 35, you should start doing all these tests as soon as possible. And if you're in Lagos, get it done at the ATG laboratories and send the results to me. I go through them and I'll tell you what you should do. A question here about what can you do for repeated yeast infection and staphylococcus infection. For yeast infection, some people suffer from yeast infections recurrently, usually due to their hygiene, okay? But sometimes too, with you taking oral contraceptive, you taking some antibiotics, you can have yeast infection repeatedly. If you're prone to yeast infection, and whenever you're giving antibiotics for any infection, always tell the doctor, I suffer from yeast infection. They'll give you canesten, or you get canesten as a cover to prevent yeast infection while you're on the antibiotics. Antibiotics is known to make yeast infection very, very, very stubborn to go. That is why it's not good to take antibiotics without respect. Respect antibiotics. Only take them if you need them. Okay, but if you've done all that, you still have yeast infection all the time, what you can do is to take Diflucan. Okay, 1 dose every week, every Sunday. Just take Diflucan to keep your vaginal environment under control. For staph infection, there's no need to worry. But if you're worried, once they give you the result, we'll tell you the antibiotic sensitivity. Usually to take ciprofloxacin or amoxicillin to treat your staph infection. Okay, so follow the microbiology advice to treat this staph infection. Okay, good. But yeast infection and staph infection rarely cause infertility. Good. Now, what is the test to diagnose uterine cervical adhesion? Is examining your cervix and doing hysteroscopy. Okay, hysteroscopy, which is this first one I mentioned. That is the test we use to diagnose uterine or cervical adhesions. Hysteroscopy. That is for Funke Abegunde Okwaleye. Oko Janet, what can I do to increase my air quality? Nothing. Sorry, Oko Janet, sorry. Let me answer the question again. Your question is, what can you do to increase your air quality? To increase your air quality, what you can do is balanced diet, lose weight, at least 4 to 5 kilograms, lose some weight. Keep your BMI under control. Number 2, balanced diet, regular exercise, okay, and taking a tablet called DHEA. Okay, DHEA helps to improve the air quality. However, there's nothing you can do to increase the egg quantity. Okay, the egg quantity is given to you by God once you're born. It will only decrease as you get older, but you can increase the quality. Okay, you can't increase the length of your life. You can only increase the quality of your life. The same thing with egg. You can increase the quality. You cannot increase the quantity. Okay, can someone do Hsg twice? You can, if necessary, if there's a full reason for that. But once you've done Hsg, one result is enough. But if the first one is not clear, maybe there was a suspected blockage in your cervix, in your cervix, in your tube, Hsg wasn't clear, difficult to do, we can repeat it again in very rare circumstances. Is it possible to do prolactin test? It was 100 after taking some medication. Now it's now 200, you're confused. That means that your prolactin is too high. Your prolactin being too high will make you not to ovulate. You need to see an endocrinologist, okay? Where is the position of the womb in the stomach? Okay. Your womb is usually below your navel button, and if you're not pregnant, it's usually below your pubic bone. If you're pregnant, your womb will be between your navel button to your pubic bone, and if you're getting towards the end of pregnancy, it's usually very big. It goes above your navel button. But if you're not pregnant, your womb is tiny womb like this, my fist size, and it's below your pubic bone. Okay? Emily Brown, sorry I missed your question. It's not intentional. Please ask your question again. I'm wholly human. Questions come very fast. It's easy to skip them while I'm answering particular questions. So if I've missed your question, the only thing you can do for me is to ask me again, because I'm only human. While I'm answering a question comes on the screen again, I miss it. It's normal because I can only use my brain and my eyes. I can use my brain once. I mean, not multiple times, okay? So please ask your question again. And I'm so sorry if I've missed your question. For you just joining, my name is Dr. Alalade, one of your team members at AsktheGynaecologist, one of the doctors here, and ATG admin here. I'm happy to be your host today. If you're just watching me, welcome once again. If you've just joining, we've been talking about hysteroscopy, Hsg, and Hysterosonogram. We've talked about the differences, what the video from the beginning to get a full gist and a full meat of the video. Queenette Annie, what is the treatment for ovarian cyst apart from surgery? Ovarian cyst is either we take it up by surgery, which you know already, Queenette Annie, but there's no medication to dissolve ovarian cyst. I know that's probably what you're trying to say. Oh, can I take a medication that will dissolve and make the cyst to go away? There's nothing like that. In most cases, we scan you back after about 3 or 4 months, and most cysts, simple cysts, ovarian cysts that are simple ovarian cysts, they disappear. And if they're still there after about 4 months or they're getting bigger, it's time to consider taking them out. The question here on Instagram, Doctor, what can someone with pelvic adhesion trying to conceive do, and what is the best treatment for adhesion? If you have pelvic adhesion, leave them alone. But if your pelvic adhesion is causing blockage in your tubes, the best way to do laparoscopy and dye test to take out the pelvic adhesions, okay? But if there's adhesion in your womb cavity, the best way to deal with that is hysteroscopy, to deal with adhesion in your womb cavity. What is the success rate of IVF? IVF success rate depends on your age, depends on your lifestyle, depends on the reason for the IVF in the first instance, amongst other reasons. So there's no, so success rate, it depends on your circumstances as well. It's not just on one factor. It depends on your ovary reserve, your ovarian reserve, depends on your age. Because if you are above 40, if you're above 45, IVF success is only about 2 to 4%. If you're younger than 30, IVF is about almost 60% or 80% if you're younger than 30. But if you're above 45, it's about 2 to 4%. So it depends on your age, the quality of your eggs, your lifestyle. You're smoking, you have damaged tubes, or your husband's sperm. So many things affect the quality and the success rate of IVF. So it's not just one thing, okay? Cervical length, 4 centimeter in pregnancy is okay. Cervical length, as far as it's more than 2.5 centimeter, 4 centimeter is okay. 4 cm is okay. Thank you guys for being here today. We're speaking for about 1 hour. If you joined too late, I'm so sorry. We'll be back again later today to talk about things again. So thank you for joining me today. I really appreciate you. From Instagram to Facebook to YouTube, God bless you and see you soon. Bye-bye.